you had fun listening to them and also watching how they do their own thing. All right, we did promise you that we had something, a very interesting discussions to do this time around. We'll be focusing on the IDP camps. And as regards, statistics, the survey that has been done recently by the NOI polls telling us that 9 out of 10 IDPs do not have quality food and regular meals in the camps. Then 8 out of 10 do not have access to potable water. We also have statistics showing us that 7 out of 10 of the IDPs, talking about 69%, lack adequate health care. And this is statistics shows is a true reflection of all that has been happening in the official and unofficial camps across the country as regards IDPs. And today we've got a very special guest via phone that will be talking to us, talking about Dr. Bell ihua, the NOI polls CEO. Good morning, sir.
Good morning.
All right, nice to have you. Thank you very much. We've seen the statistics done by NOI polls. I want to say big thank you for the job well done. For you, how did you receive the statistics that was churned out after the survey done as regards IDPs in the country?
Okay, thank you very much for having me. First off, I think I need to sort of lay a foundation on why it was important to conduct this survey on IDPs in the northeast region of Nigeria. So this survey really was to sort of gather first-hand information from IDPs and some of the key stakeholders working with IDPs in the country. And our aim was to demystify the controversies surrounding the welfare of IDPs. So there have been a lot of talk, a lot of anecdotal stories about situations with IDP in the Northeast, but there had been nothing really scientific. So we thought we should go in as researchers, as pollsters, to gather scientific information which we can use to support the government. So the aim of this survey was to provide an independent, unbiased, and on-the-ground assessment of living conditions of IDPs in the Northeast living in both official and unofficial camps. And I can tell you that in summary, IDPs are living in very deplorable conditions, and they lack food, they lack water, and they lack basic health care.
All right, I've got Pius, my colleague. He has some very important questions he wants to throw to you.
Yeah, Doctor, I would like to ask, while you were busy carrying out the survey, were you actually on ground in Maiduguri, maybe in the Northeast, were you actually on ground? And if yes,
absolutely,
is it
absolutely.
true? Yeah, I'm trying to make my points, Doctor. If you are actually on ground in the Northeast, now could you confirm to us that some of the females in the IDP camps, because they lack food, like you've rightly stated, are now, alternatively running into prostitution? Is it true?
Yes, indeed. I should state clearly that we were on ground. I actually personally led the delegation to Maiduguri, to Damaturu in Yobe State, and to Yola in Adamawa State. I led the delegation, and we were on ground. I can't tell you the deplorable situation in the camps and even the host communities, which are termed as unofficial camps. So, as a result of starvation and hunger, from lack of food, access to potable water and health care, we realized a few things. So, one, we observed that in some of the camps, IDPs are taken more or less almost as prisoners. They don't have free access to movement. They don't have free access in and out of the camp. They don't have access to telephones, even to communicate with the outside world. And a lot of the IDPs are now even taken to crime. So some of the ladies, in order to survive, are going into prostitution. Some of the young men, in order to survive, are even taken into hard drugs and going into crime. So these were issues which we observed on the camps and in the host communities.
Okay, for the period at which you were right there at the camp, in the Northeast. Now, we've been told that there are a whole lot of humanitarian assistance coming into some of these camps. Can you tell us how many assistance you were able to to witness, during the period of carrying out your investigation? Or are all these reports just on paper and the reality is showing otherwise?
No, the reality is that we even have IDPs who are alive and who are still there is because of the work that the humanitarian aid workers and aid agencies are providing. And I must acknowledge and commend the efforts of these guys. To be honest, organizations like ICRC, organizations like Save the Children, Social Welfare Network, organizations like KUPI are providing various humanitarian assistance. So in some cases, they are providing food. The World Food Program is also on ground. In some cases, they are also providing healthcare and medical services. But it's not enough. It's not enough. And that's why we are bringing out this survey so that, the government at both the federal level, the state level, can also come in and intervene. One major issue we observe is lack of coordination between the federal agency, say the NEMA, and the state SEMA. So there was an MOU that stated that NEMA will provide foodstuff for the IDPs, while SEMA, the state agencies, will provide logistics and condiments for cooking. So we found out that in certain situations or in certain camps, many times NEMA may default on their own side of the MOU by not providing the foodstuff on time, and because of that, sometimes IDPs will go hungry. Oftentimes, even when NEMA meets its part of the MOU and provides foodstuff, sometimes issues as little as lack of firewood can keep IDPs hungry for many days. And this has gone on for a while. So effective communication, effective synergy between NEMA and SEMA was one of the things we sort of recommended to help that situation.
All right, the laudable NOI polls survey did show that 7 out of 10 IDPs lack adequate health care. That's talking about 69%. For you, what's the possibility of Nigeria achieving a polio-free status as regards the children in the IDP camps, which the Ministry of Health is trying to battle as of recent?
Well, very, very good question. And I think with what we saw on ground in the Northeast region, a lot more has to be done health-wise. So there is inadequate healthcare facilities and inadequate healthcare personnel. So even the personnel on ground to provide healthcare are lacking. And this is also a call to the ministries, relevant ministries of health, interior, NIMC, population. There are implications for various ministries, departments, and agencies of government as it concerns the IDP issue, not only for health. For water resources, for example, in some of the camps housing over 24,000 to 100,000 IDPs, you have only 1 or 2 boreholes. The 1 or 2 boreholes can barely provide enough water to service cooking, talk more of water for IDPs to be able to have their bath, drink, or even have quality sanitary conditions. So there are implications for various agencies of government here.
All right, my next question goes, you did raise an issue that somewhere along the line when you were on ground, you noticed that the IDP camps were almost looking like a prison yard. Could you really share more light as regards what you meant by that?
Yes, indeed. We realized that some of the camps visited, especially in Maiduguri, IDPs are not allowed free access to movement. So they can't move in and out of the camp as they like. Secondly, they are not allowed to own phones. They're not allowed to communicate with the outside world. They are kept in, and it's because of the deplorable conditions we reckon is because the camp officials do not want information about the deplorable living conditions in the camp to filter out to the outside community. And that's why part of our recommendation in this survey was that the need for an unannounced presidential visit to at least Maiduguri. Because what happens is when there is an announced visit, there's a lot of window dressing. The camp officials maybe try to get some clothes to the IDPs, try to prepare some good food on that day, to give the visitor, the guest, the impression that this is what happens every day. But unfortunately, for some days, for many days, some of the IDPs are even left hungry because of inadequate food. So we see a situation where not only that access to movement, freedom of movement, which is one of the human rights, but freedom of also association. So they can't access the outside world, and this is something that we think that the authorities need to also look into.
All right, Doctor, you just spoke about a whole lot of window dressing if there's going to be a presidential visit. That reminds me of the visit of a former vice president to one of the IDP camps in Maiduguri, where we saw pictures of him, you know, taking a spoon of the food prepared in the IDP camps. So are you saying that from what you've observed on ground, is that also part of a window dressing in as much as you were actually on ground to see things for yourself?
You see, I'll tell you what we found from our data. Our data clearly shows that IDPs are not getting food. So 85% at least of IDPs lack access to food. So yes, the vice president had visited at some point, but from what I can tell you, scientifically, from the data gathered, IDPs do not have access to food. And I think that the recent protest of IDPs blocking off major roads and streets in Maiduguri is a testimony to the fact that they don't have access to food. And in our report, we did conclude, or we mentioned that, yes, those IDPs have been sort of asked to move back into camp, and the military are there sort of asking them or telling them to remain in camps. It will only be short-lived until a long-lasting solution is provided to support the IDPs. A hungry man is an angry man. There's so long that you can keep these people in as long as they're hungry. They will eventually, out of frustration, come out of the camp again, and we may then see more protests coming on. But if this issue is nipped at the bud, if the government wades into the matter, I mean, there are allegations of corruption. Corruption at the macro level, at the senior state government levels, and at the micro level, at the camp official levels, of diversion of relief materials, diversion of food. There's need for investigation into all these issues because till we are able to ascertain all the monies allocated for IDPs, all the food, where have they gone? We won't be able to make progress. And that's why one of our recommendations is an effective M&E system, an effective monitoring and evaluation system where whatever is allocated to the IDPs at the federal level, at state level, by international organizations, or by philanthropies like Dangote Foundation, T.Y. Danjuma Foundation, and co, get to the IDPs who need it. Because we can tell you categorically, most of what is allocated to the IDPs simply do not get to them.
Wow, that's very, very unfortunate. Now, could you tell us what your experience looks like? Because we're being told that maybe per day, you know, we have 2 to 3 children who suffer from malnutrition, you know, giving up and them just dying like that. Could you just tell us what the environment of the camp looks like? Because we're also reliably told that there are a couple of graveyards, you know, around the camp as a result of malnutrition, especially on our children, you know, around that area. So what's your experience like?
You're absolutely right. We also observed a high mortality rate of IDPs in the camps and unofficial camps. So at least, and when we ask the IDPs this question, 88% of them confirm that they see regular incidents of death of fellow IDPs. So in fact, in one of the camps where we were conducting our survey called Arabic Teachers College Camp in Maiduguri, there was a cholera outbreak while the study was going on. And while we were there conducting it, 2 persons, we had just been informed that 2 persons had just passed on. And you could see the way everyone was going on about their normal business, as if these are not lives of Nigerians, lives of citizens that have just been lost. To the IDPs, it was sort of, it's okay, at least the less people we have, the more access we can have to food. To the camp officials, it was more like an I don't care attitude. And this is wrong. I mean, these are avoidable deaths which can be avoided by proper health care, medical facilities and personnel, but they're not available. So some of the IDPs even complain that when they are ill, they no longer want to go to the health centers because the health centers are in shambles. You don't see any staff there. Even when you see, they give you the same medication for various kind of illness. And this is why a lot of the mortality rate is high. So there's need for the Ministry of State, even at the federal level and the state level, to look into the issue of medicines, lack of medicines in camps and host communities, and the issue of personnel. To be honest, from our survey, we found that the military has done a great job to push back the insurgents and to improve the security condition in the region. So there's need for more medical facilities, more medicines, and medical personnel to come into the region. International agencies like the Medicine Sans Frontières, the Doctors Without Borders, are doing a great job on ground. But the amount of work is overwhelming, that the job they are doing is like a drop in the ocean compared to what is on ground.
All right, Doc, you mentioned about the fact that there's need for a very effective monitoring of whatever goodies coming to the camps. Do you think it will be time or a good idea for the CSOs, civil society organizations, to probably come in and coordinate affairs at the IDP camp? That's one. Then the second of all, what do you intend to do with the survey report you've gotten? Do you intend to send it to the UN and other international bodies as a way of getting support?
Well, to respond to your first question, yes. And this is part of our recommendation. So we realized that the model of providing intervention to IDPs, which has been adopted, have had issues. So the model is such that, food items or NFIs, non-food items, are given to or handed over to state government officials via SEMA to then pass on to the IDPs. But from our reckoning, that has not worked. It doesn't get to the IDPs. There have been allegations of rebagging, allegations of diversion, allegations of disappearing trailers of rice. Our suggestion is that they should adopt a different model which seems to have worked, and that is the model of working with the local CSOs and NGOs. The local CSOs and NGOs go into the communities, identify strategic IDPs, come up with concrete data, and from the data, they're able to provide these relief materials. And the Dangote Foundation has used this model successfully, and they've made huge success in their implementation of relief materials to the IDPs in the Northeast. To answer your second question, we have put all this information, and that's why I'm even granting an interview such as this. Our work as researchers, as posters, are to remain independent, but to provide the numbers, to provide the stats, to provide the research, to help policymakers, to help the government, to help international agencies, to help CSOs strengthen their advocacy. We are not advocates, so we don't go out to advocate. But our work is to provide the data, to provide the information, to help the advocates, to help everyone who needs to understand the true position of things in the Northeast as it concerns the IDPs.
Okay, I would like to know where exactly your data is as we speak. Have you concluded your investigations, and where exactly have you sent those reports to as we speak?
Yes, we held a public launch last week Tuesday, where we invited stakeholders from public sector, philanthropic organizations, international development agencies, and we put it out there. And in the days that have passed, we have also been sending out hard copies to various agencies, various organizations locally. So we've been putting out the information out there. We've also sent it to the office of the president, the vice president, the senate president, the speaker, and everyone sort of who we think need to be aware of these results and need to take action on it. We've also sent it to ministries, departments and agencies of government who we think would need this sort of information we're providing. I should also state clearly that this is not exhaustive, but this is the contribution of NOI polls to put in numbers and to helping to provide a scientific evidence to the issues of IDPs in the country. More studies need to be conducted, more researches need to be done. We're happy to help, but then research needs to be funded. We think that the government has a role to play in funding research. International organizations also have a role to play in funding research, and and we look forward to collaborating with anyone who really wants to fund the research of this nature, to push out the information and to help get a clear picture of what's happening on ground. It's one idea to write stories outside the region. It's another thing to be on ground, to physically see the issues IDPs are facing on a daily basis, and that's what we sought to do and we try to achieve.
Okay, finally from us here, as it stands, what are the response you've gotten so far from some of the persons you've made mention of that you've given your
been
research to?
very good response, actually, and we've been having a lot of people sending us emails to ask us to send soft copies to them, and it's even on the press release we put out. We said if anyone wants a soft copy, just send an email to editor@noi-polls.com. We would be glad to send soft copies. We'll be glad to send. It's free. It's our own contribution to the country, and anyone who wants to have access to the data, to the report, we are glad to share.
All right, I want to say a big thank you, Dr. Bell here, NOI Polls Chief Executive Officer, for the wonderful job you're doing for the country. I want to say a big thank you.
My pleasure. Thank you for having me.
All right, thank you. All right, that's how we'll call it a wrap on that interview with the NOI Polls boss as regards happenings at the IDP camps, both the official and unofficial camps across the country. All right, we'll be going for a very quick break, and when we return,
we'll be looking at Edo politics. Tomorrow is Wednesday, the 28th day of September, and that's when the Edo State governorship poll
finally it came.
Finally, we just hope it won't be postponed again. So we'll be looking at all of that and the antecedents, cropping up, barely 24 hours to the polls, and we'll be having a guest together. We'll be looking at all of this. Please don't go anywhere. We'll be right back just after this break.